Good afternoon. I'm Dr. Steve Wexner from Cleveland Clinic, and I'm going to chat with you a few minutes about Colorectal Cancer Awareness Month. But I think we're going to bring the camera a little closer because, sorry, it's my first Zubia broadcast and just getting used to the positioning. We may put it down here. Let's see how this works. That seems reasonable. That's good. So, good afternoon again. I'm still Dr. Steve Wexner from the Cleveland Clinic in Weston, Florida, part of the Cleveland Clinic Health Enterprise. The views I'm discussing today are my own personal views, not officially represented by Cleveland Clinic Florida or Cleveland Clinic Foundation. But my role here at the Cleveland Clinic is chairman of the Department of Colorectal Surgery, as well as director of the Digestive Disease Center. I wanted to take this opportunity to spend a few minutes with you discussing a very important topic, and that's colorectal cancer. March is Colorectal Cancer Awareness Month, and as such, it's very important that people understand the implications of colorectal cancer. Colorectal cancer is one of the most prevalent cancers in the United States and is becoming more prevalent in many other countries. Typically, it was a disease seen in Western countries, but it's now being seen with increasing frequency in many other countries around the world, in Asian countries, in Mideastern countries. That's perhaps thought to be due to dietary changes, to environmental changes in those places where they have become more, quote unquote, westernized. Now, in this country, colorectal cancer ranks right up there with breast and lung and prostate. But the fundamental difference between colorectal cancer and all of the other cancers is it is largely preventable. Now, to some degree, it's preventable by adapting the dietary habits of countries in which there's a low incidence, low prevalence. In other words, eating a lot of raw fruits, raw vegetables, limiting or eliminating processed meat intake, cooked meat intake, having some supplemental vitamin C and aspirin. All these things have been thought to perhaps influence colorectal cancer and polyp formation. Exercise rather than sedentary lifestyle, limit amount of alcohol, don't have any tobacco intake. These are all things that are thought to be important as opposed to, again, sedentary lifestyle with lots of meat and alcohol and cigarettes and such. So yes, that's one thing you can do to help prevent, but depending upon your genetic programming, you may still be predisposed to develop colorectal cancer. And that is different than in other parts of the world. We have a different gene pool, obviously, in this country in terms of different types of cancer. Does it morph over time in terms of the environment? Perhaps. But we're now at a point in time where, unfortunately, we're seeing an increasing number of colorectal cancers in patients of decreasing age. So more younger patients are coming in with cancers. And unfortunately, those cancers tend to be very advanced. Why? They're not per se necessarily more aggressive cancers, but patients come in and they have symptoms. Younger patients typically will come in with rectal bleeding or abdominal pain, and the symptoms are written off as being due to hemorrhoids in the former case or irritable bowel in the latter. And the investigations, such as a colonoscopy, are not undertaken. And unfortunately, by the time some of these patients do present for appropriate diagnosis, the cancers are more advanced. That's one problem. The second problem is that about half of colorectal cancers do not offer any symptoms. So roughly half of patients have no symptoms. Patients don't have rectal bleeding. Patients don't have abdominal pain. They don't have changes. Certainly, if you have any of those things, you absolutely should go to be screened. You should be assessed by a gastroenterologist or a colorectal surgeon or a general surgeon, whoever in your area is taking care of colorectal problems, and say, I've had a change in my bowel habits, or I've had this unexplained bleeding, or I've had unexplained weight loss or blood in the stool. That should allow and prompt an investigation. However, for the majority of the population, they're never going to have symptoms, yet they may have polyps, which are the precursors to cancer. So the way that colorectal cancer is different than prostate and breast and lung cancer, the precursor lesion, in other words, The little abnormality before it becomes a cancer is called a polyp. And a polyp can be either a flat lesion on the lining of the colon, or it can be a little pedunculated thing. In other words, something growing out of the wall on a stalk. Those little growths, which are not yet cancerous, will become cancerous if left long enough in most cases, but they can be removed. So when a screening colonoscopy is done for somebody without a family history, that colonoscopy may detect these precancerous growths, and they can be removed. So that colon cancer can be prevented not just by these broad brushstrokes of diet and exercise and healthy lifestyles, but very specifically by undergoing screening colonoscopy according to the guidelines that have been set forth by many organizations and followed by organizations, by healthcare payers, by virtually everybody who has anything to do with health understands it's important to get screened starting at age 50. If somebody in your family had colorectal cancer, first-degree relative, like a parent, sibling, or child, starting 10 years younger than the youngest patient in your family, youngest person in your family who had the cancer, if not age 50, and depending upon what's found, undergoing further colonoscopies. So the worst part of the colonoscopy is the bowel prep. But once that's over, you can go, you can have it done. It can be done by a colorectal surgeon, general surgeon, gastroenterologist. There are many people who perform these examinations and have the colon assessed and either leave with a clean bill of health or leave having been told that, yes, you had one or more of these little growths, but we took them out. They're not going to become cancers. That is the best way to deal with it. And we're very privileged in my field in colorectal surgery that we take care of a tumor, which is preventable in most, certainly the vast majority of cases. If polyps were removed, they wouldn't go on to become cancer. So screening colonoscopy is critical. But even if you present with a cancer, we have made huge strides in the last several decades in terms of treatment of those cancers. Firstly, most of the surgery now is done in a minimally invasive fashion through keyhole surgery, cameras, and small instruments. Secondly, people have always traditionally been afraid of having to wear a bag. Even for the cancers which traditionally required that type of treatment, our multidisciplinary team approach with pathology, radiology, radiation oncology, medical oncology, we can target treatment to try to make as few of those lesions as possible still need to undergo that type of surgery. So in other words, thinking of it another way, we can treat almost all cancers without the need for a permanent bag. Not quite all, but we've developed many of these minimally invasive techniques and team approaches to try to optimize outcomes, to optimize survival, to optimize rates of the tumor returning, and we've really made huge strides. So the best thing that I can tell you is to undergo a screening colonoscopy. But even if something is found, the other good news is it can be treated very effectively in a much better way than we could have treated it 30 years ago, now using minimally invasive techniques and what we call sphincter sparing techniques for rectal cancers to avoid a permanent bag. So in the interim, prior to your screening colonoscopy, stay with a healthy diet. And after the screening colonoscopy, still stay with a healthy diet. And don't be sedentary. Exercise, lots of physical activity is good for you. Don't ignore symptoms. And if you're told that your symptoms are something benign, you may choose potentially to either get a second opinion or wait a while and see if they resolve. But I would urge you that colorectal cancer can be and often is a silent disease, and therefore investigation is warranted. Again, the diagnosis is made the same way as with polyps, colonoscopy. There are other ways, but that remains to date the gold standard. So March is Colorectal Cancer Awareness Month. It's almost over. I hope that I've helped make some of us in the audience a bit more aware than may have been the case prior to the broadcast, and look forward to speaking to you again in a couple of days when we're going into much more detail on the theme from a meeting at which I'll be giving a keynote address in the south of India. In the meantime, enjoy the rest of the day.